kamurithiria wa Meru TV na kankwate ogeni kiri mubango jwa Ugima Bwetu ani aratwaraire mirimo ira yomba kwithira ikuthangike na bura tumba kwithira tu mitungatira kendo otira uri na ugima bumwe bwa mwiri ulimite wateri Mbaabu na tukwirwa ari tuketha twina kaitha kakeka kwariria murimo jo kumenyekana ya asthma na turi na mutaalamu ndene ya studio yetu. Karibu sana daktari.
Asante.
Ni bwana ntoba kona kanya kakoya kende muleithiri wa Meru TV.
Mwene ya Meru rieto mbita wa daktari Patrick Nyokubai. Bitawana ngui na Meru University of Science and Technology. Na mbita day consulting and visiting medical personnel at life care healthcare. So bokendo mona na bumbidire au kana bomba na Meru University. Yes.
Asthma imurimo yu kuna yoringi basi na daktari.
Asthma imurimo yumbite otorani na antu myake mingi sana. Na asthma imurimo irayo wata antu banene na antu banini kana ya bwana. Na ndene dunia imurimo yoretie kwira yo rahite ana baba inge muno. Kroki antu banene. Na imurimo kinya World Health Organization yeretie kwariria muno. Na kwenda kumenya ata antu batetheka kenda tumba kunichi ikubi kiri antu banene na kitwana nonto imurimo antu batumba ku manage boboya nonto bwa misinformation na misconception kana mantu antu batwana chia maroi na mantu amainge. So asthma imurimo yumba kwa adult kana imurimo yumba ku manage boboya bonka mtu akimya the causing agent kana imbibyo ba kuyureta muno asima te murimo yora yatana chukuma ke muntu kireyonge tuyeta non-communicable disease non-communicable kwa murimo tume yakwa transmitted itumba kwa watu muntu yo muntu yo enayo but it is genetically associated ibon kamba kuo you affect part ya mwili yeta wa maori kana lungs na ila yuka affecti maori ile mtu ale mwa kuikia miruki boboya ndo bo kuimba actually ni inflammation triggers ya sima imno ndo bo kuidra we mwiri yote kumba kwa sensitize kwenda kuna allergens kana ndo bila with allergic kibyo ndo bi there is a wide range so tukari to kinyanto au but maybe tukena statistics you present in a wiz ilo kulinga mirori ukaigwa kibara ikiringa mirori kana ikirita sauti tikueleweka kitwana no na inyame nyoro itaita kianto bana no ibe kibara ikiritwa na muno kiri anto banene kuna obvious triggers so mtu akidra kimenya ibi trigger yo no aumbe kurieria ndene dunia antu milioni maana ile ya 60 na yire ibedirite bena murimo yu statistics shenda bio ichoche 2019 na ikuo bibyo mbete kuoneka munga 2019 ni ikuo around 455,000 antu iba kwete nonto okumani na asthma ndiri kuendelea onto Kenya kana Sub-Saharan Africa ichoshi affect mno kana ikuo murimo yu kuendelea kuingia na wingi. Maybe there are a lot of complications, but you wonder what murimo tumbo control, murimo tumbo kuriyeria, na murimo manageable, using what we call life modification strategies, na inya specific clinical treatment, medical treatment, tuitu mairandawa, na inya shi tukomba kuweka, wala tukiendelea. Maybe kire asthma, kota kaua. It is one of the strategies mandu ya kintu twita universal health care to make sure asthma ikuomba kwa controlled yimbo komba kuodai
na dine yuma daktari
now auko kwenda kuri about causes so nke ya inko bangete ko ndo twita demystifying diseases woni kidomo yako ingidi mandu ya public health at higher degree PhD so ko ndo twita disease demystification maitama inge twita achibitare uko karamu tweta akawa kibareke kuingana uko kibareke kuingana ukayonda wache kuingura kibara wachianira oikia mwana hospitali ko wena alanje ukero alanje iruiro ampio ukero alanje iteri ukero alanje ibyo kore fulani
Utoko mene asthma.
No, whether you can an asthma, but we have not treated the cause. So when we talk of demystifying medicine or demystifying diseases, then we take a breath and demystify asthma. Kuchero huo, no menya asthma imbi. Okay, and kumenya asthma imbi, no, identify the cause, attack the source of the disease. Kwa attack the source of disease, remember murimo yo ina communicable disease, kana murimo yo tumba transmitted from one person to another. So no monga kwenda kuna genetical predisposition. Genetical predisposition ikuwa asthma no monga kwenda kwe some parts of the blood of the body genes ile chiombo transmit asthma kuma ki mwana ki mochiari na mochiari yombi. Lakini tekuwa na balonde baraba chiari mtu fulani bakan develop asthma. You can find in a population of 10 people ni antu batanda to bakawato ne asthma.
Kumto.
So tena asthma mwana wina muchiari achiari bena asthma no bawato ne asthma. It's a risk. It's a risk factor. So to risk factor na kiatu mina waburi kwenda kukiria kintu kita life modification. Life modification no buri kwa identify imbi because bio trigger this asthmatic attack kana allergy. Onto asthma ni allergy present in the lungs. Okay, agwata ni allergy ya meta tumeta conjunctivitis. Acute conjunctivitis. O atone allergy ngozi tumeta acute dermatitis.
Kuhude na iya.
O atone allergy minyoro tumeta acute rhinitis. So o atone lungs iki affect mauri yakaingana tumeta asthma. Yes, so it's an allergic reaction which presents in the lung. Kana present in the mauri ya mwana kana ya mtu mnene. So ora kia kuwa no yume ki muchiari yata ki mwana. Lakini no iri.
Mtu musiari wina asthma no ariye mwana katika watu.
No ariye. Uka watch out kana uka light area. Ibyo kora biyo go ata mwana ya trigger that asthma. No ndo imuri yo ya sensitized to some antibodies. Antibodies antigen reaction. Mori uka develop antibodies against the disease. Kana murimo yuke edera run mori yo sensitized. Ora mo njoke oyo mo njoke renge ora mo njoke mbere ukaimba. Ora mo njoke yarele no wireke. No to mori yo rende you prepare some antibodies against the allergen.
Mtu inasema ile kurabia kwa particular daktari. So
nkendo bwera sana no to tijika mtu na life experience nawe I can comfortably say uni usiele kona ari asthmatic. Wetu actually antubaili badatu iba develop asthma. Including myself. Lakini wonte nyanda I don't take drugs. Nyanda wana na indore inda actually lakini I was able to identify inda umere kwa manyimbi bitu macho. Ngabura practical example ya wonda wata wane asthmatic attack mno ndanyo kintu kita wine.
Ndore kana na wine umenya wine.
So immediately I stopped taking wine. It's okay. I don't use an inhaler. I don't use anything. Tetumare interview. So asthma no ibiro kure. There is an allergen. There is that dust, specific dust, not all dust. So sometimes we blame dust, no lakini wonimbo na jokora hivi no yule tadi nayo, yule tadi those allergies. Na okay akuomba ku identify the problem. You attack the source of the allergy. You are safe and sound.
Ako nyudhiara na kutumia mtu akawata ni
allergens. And these allergens they include so many things. Dust, food, nkendobora amanda ya immunological reactions. Asthma imode yo ya react in a different food. Negeto miona nyaka ana kachi yaroka introduce wana byo kure pole. No ndoko introduce byo kure bibinge metembe minge. Byo kure bidamya it's a chemical. Ikari ati na mwene yo kambia kuimba. No te kumisa indire go kambia kuimbira. No yimbe dene mauri, no yimbe mi laito, no yimbe skin. So that swelling nyo to it now it can cause narrowing of the bronchioles. Mi pipe ya ero. The bronchioles. Che imbari yo ko ingana ukawata that reason. So if you can identify omba kumenya integrated asthma, it will be very easy to treat it.
Nende awoe tamanto ya bronchitis. Lila mtu arina asthma kana asthma ni there in a relationship in na complications ya nkoro?
Actually, there is direct proportion. They are directly proportion related. There's a proportional relationship between asthma and heart disease. Nonto mwere remember maori ya bwethi ya kutithia kintu kitawa delivery of oxygen. Kana kinyithia ruo dene mwere. Ruo iro acti ya mauta ya mwere ya kuithia bia kuria. That's a source of energy. It fuels the metabolism. So kenda bikora bida biuna ngwana bithira bikire bituma ikandene mwere. No mo oxygen yithira leo. So oxygen yake ya kura. It means mwere yote onai energy because there will be no metabolism. Our factors are constant. So okay, akwato ni asthma, prolonged and the complication of asthma, it leads to bronchitis. Bronchitis will lead to pulmonary effect. So warankoro ya chiumia kuringa na inya. Ya chiumia kuringa na inya kende the liver, the little oxygen which is coming. You get what we call arrhythmias. Nkoro yambie kuringa itina inene onda. Kana watu kintu tuta tachycardia. Watu mkoro ite kuringa systematic. Tachycardia nkoro kuringa na rate reoro. Nonto normally yonto ke mwana the normal heart rate can go up to 114. Mdo mnene heart rate can be from 68 to 72. So say up to 78. But toriwa nkoro iguri kuringa normally 72 beats per minute. So ekeda ne kuringa nkoro kinonto ne kwa ku pump damu enyinge kende kinyibia rugo kiongo. I mean oxygen kiongo. Nonto oxygen mwere utomba butumio survive more than 4 minutes without oxygen. That's how long your brain can survive without oxygen. So the heart is very important to deliver what? Oxygen by pumping blood which is oxygenated. Nanda muone ya oxygenated wako lungs. So when you are asthmatic, it can lead to the other complication. So and whenever you are asthmatic, sometimes most of them end up in getting heart failure. Yes. Nkoro kaya ara maana ntuko kuringa maitama inge ikawato kintu kita cardiomyopathy. Cardiomyopathy inkoro kuala. Yes.
Nakaita kara mutari na awatu ni asima ataki no wakwe kana independent na stingira mutari.
Asthmatic attack are very dangerous. Oibo towa okay awache rogo nkoro kienda igita to mungainya otombo you can get serious complication.
Kono. So
no ukwe. Hiyo to mwiba statistics ito ayana many people die. Ndio ingiba kuya mno kana nyana kwanza ana mno kuya ana mtu wako kwedra. Pare asthmatic kana bena bronchospasms nonto kiriana ite ambire ya asthma nonto ko into the moderate intermediate then severe. So depending on what type of asthma, at what level of asthma you are, then you can get those complications.
Na daktari ibyo na nilibiri ko mtu amba kuona kamenya dina asthma.
With a risky asthma. Now, risky asthma ndakwera first of all there is genetic predisposition. No monga kwedire kwe mtu wa the asthmatic kwenu kana no develop because of course other factors. Ndo tuje mwere te asthma we what 100% ya bibi ke mushiyari yoko. So predisposing factors to no ni environment. Like if you go to an environment which is very cold and there is a predisposition with a risky factor or exposure, you can develop asthma. Exposure iko na wina genetic makeup, lakini tela asthma wedere already asthmatic. So to ke trigger into bila bia ke muri yako we develop asthma, it will be very easy. So no monka wedere wo ke menya ko identify keda we at risk of developing asthma or not. Bonge mno ni kurokuritira ngwe. If you are working in a very dusty environment, you can trigger some allergens which are dormant. For example, in your body, to genetically you are predisposed. So with the kuritangwe kunto kuina tiri nyingi kana kuina yonto mites. No, there is what we call mites. Mites, it's what stays okay, what a teddy on toilet nyumba, make under microscope. You meet a lot of mites. And those mites are known to trigger asthma or asthmatic attack. So to carry asthma no triggers usually to arrhythmia. But what I usually tell people, response to asthma, it is individualized, treatment is individualized, and it can be controlled. It's one of the communicable diseases, I mean non-communicable diseases. Itumba kuriyeria kabisa na antu bakora na bakaria maisha normal just like me.
Kwa yomba kuriyeria
completely.
Na mtu kuriyeria.
Yomba kuriyeria nonto already you know you are at risk. Like me, before I knew, I had taken drugs for almost 5 years. At some point I was almost losing hope. So what we are saying, when we identify keda we na risk ya asthma. It is what we call positive health seeking behavior. Lakini maitama ingi anta batita hospitali batea yetu. Kinya mwana watu kibana bawe ndi moni ba mwanda. Actually we lose a lot of children. By a chemist mtu akauranda syrup. And most of the our health outlets actually buy an andawashita bronchodilator. So bronchodilator mekiera kibara kana pipeline kibara te kubwa mtu akuora. You have not attacked the source. On the disease prevention, you need to attack the source, protect the host, interrupt transmission. Transmission is very difficult to interrupt for non-communicable disease. Non to tell antu bakenda na bachiera kana kena asthma. You get? Lakini ku attack the source na ku protect the host we can. Non to the source ito kumenya imbi it trigger what is triggering the kada iwe dira chiyo ene kana iwe ta goria untu na teri you can avoid that. Kada iwe na mpia ro trigger you can avoid that. But all factors are only constant. You can do also what you call lifestyle modification. Lifestyle modification is like what I did. I stopped taking wine. Immediately stop taking wine because it has a chemical we call either a chemical it was sulfur. Sulfur one and whatever they are sulfur based drugs. Near to my water attack for my case. So when we are talking about asthma, nobody will identify what is really causing the problem.
Tutenendi kiri types kana mithemba ya asthma.
Mithemba ya asthma ni mingi. Kuna asthma ya twana, kuna asthma ya antu banene. So as you think about asthma, we really we can no to asthma kit wana asthma kile antu banene. But muno benda kwa rede twana no antu banene. It is when we confirm this really that person is asthma. To make a allergy, but when it complicates now, you can't treatment in bronchodilators is when we say that this person is asthmatic. Kitu wana to make bronchospasms. Bronchospasms iko ingana tu kona mwana menyoro ikaya yake ikuina ndanzi, wana menyoro to make a flaring of allergies. Menyoro kona menyoro to boto menyoro to kwedio. Huko kona ni mwana huu and very difficult in breathing. No yedere asthma. Kana yedere bronchospasm ito kuela kana yedere just tonsil a glance kuimba ena kitu tuita adenoids kuimba tu nyingi tu minyoro na toiba ryo mwana ena those problems maitama nyingi kireana itu enda atia riba menya it can clear and it can complicate to asthma. So tutenda mwana eta okay, my time and get to write about asthma. At what age should you diagnose a child asthmatic? One attack look at the Miaka 12, but we will confirm asthmatic. We should do what we call conservative management. My time and get to Kumatoka with a Kutenja Inyana, Grita, Handenoins, and so many other things. Kimero Sana. So nobody could know what is the alternative treatment. Not to see alternative treatment in maybe with the different lifestyle modification and about now I end up with asthmatic.
Alafu daktari kaita karamu mwana ingana ni tayari liko batiko ya dire mbere.
Immediately mwana ingana there are two things. Non toke ya kuona mwana ake ingana it's something serious. Kwento tweta inhalers na inhalers it's shoto tumaira na inya na you can use an inhaler. Non to inhaler ni ari ukwe. Na inhaler there are different types. Na okay akona mwana akiwa hata ni asthmatic attack te kuona ni asthmatic attack yake. Either in a pneumonia or in some other disease. So asthma will be triggered also by other problems. So no either inya and dehydration. So you make sure first of all everything is taken care of. As in muike muritanguo mwanora eria umuikantua kumba ku breathe. Make sure then to ingite murimo, you clear the knee, then try to give the inhaler. Inhaler you give in puffs. There are different types. Which is aminophylline, epinephrine. Different inhalers exist in the market. We may not want to market any other product. So kuna so many drugs. Kuma uno antibiotics. So you start with a bronchodilator, then most of our asthmatic patients inhaler. They know. Most of them they know because it is usually not something which occurs suddenly. Asthma is usually classified into 4 categories. They present into 4 categories. Na categories yuko na severe episodes na kwa severe episodes. So when we talk of asthma in adults, the smooth muscles, kana muscles chiuchia bronchioles ichire tadina, they could respond very seriously to allergens. Na njira ya kutreat those asthma, kana kumanage those asthma is through the drugs, and there is no other way of doing that. Asthma kire antubanene nireta complication nyingi, na complication yembere in bronchitis. The most serious complication is bronchitis. So what are the signs and symptoms? And it's good we talk about the signs and symptoms. So when asthma yeta mild, you can have mild attacks. You can have moderate attack and severe attacks. So neta mtu present a severe attack ya asthma. Ebere wina breathlessness at rest. Kinyo karinde uto karinde wana mtu nakora moyo kiamiruki. Oibo mtu akaria keita marieto. Muscles chiongwa kana mwiri ukaibo nuko noa. No keda oteko tumira muscles ichi akibarache ko breathe, okeda i muscles cheke uko breathe. Ona nyake uke move very fast. Tushita accessory muscles of respiration. Then ukiritameruke ando ritameruke comfortably, okeda no kuritameruke ukinoa na ikirita kasauti karatu kuita wheeze. Of course okay yakuye machine ya kupima oxygen saturation, okeda the oxygen saturation is less than 90%. For moderate attack of asthma, how we measure the severity in adults. Not we classify according to severity. Okay, the mtu na kuremwa iko breathe akiarachia. Okay, the mtu na kuita marieto akiarachia. Na sometimes okay na utumira muscles yiche kiula lakini tena inya. Na what the oxygen saturation, amu yeshi bitaya okay the oxygen concentration in between 90 to 94%. Nebuli kwede 100%. All factors are constant. You get to me get them from your no take we go kila moyo breathe. Now you are using your nose to breathe and it's okay. Mild attack shia asthma ki antubane mno kauno oditangu ukanoa. We just as you canoa. But you should have a differential diagnosis. No to know whether okay I want one yako no whether it asthma in heart disease. Heart disease and asthma sometimes they can be confused. Want to know about changanya whether atakumaniko. So mtu unaomba kwa alia boya hati kuita meambo na eda ena gitu tuita adilia kukimeruka ile uibe choka sauti karatu kuita wheeze kauma kuiba yaka kibara kuringa miruri yoto kuita wheeze. So all in the pass rate kana nkoro kuringa kuiba enomo na saturation yake oxygen can breathe almost 94%. So ateo ni yake na difficulty in breathing. You know to mild asthma na kile antubane of course those asthma chionda chi mwanya management na ndawa itu mwanya na mno tutumira inhaler ki mild asthma kwa banyenya che komeria. So it will depend with the severity of asthma.
Na kuangaratana na kuithire kikiona ni ile kia asthma
confusion. Anytime of course more you get to kuma kulitangu ibo ya that's a complication but it is not very common. Rare. Those are rare complications.
Treatment.
So treatment options, these asthma cases. I will mention a few drugs, but not specific drug. So to no to tumere inhalers. Inhaler you can have salbutamol. Salbutamol is a common you teaches you can mention. But kenda which on the china steroids na aminophylline. Aminophylline is a bronchodilator. Steroids na chini ya anti-inflammatory. Anti-inflammatory kuweche kuliria kuimba kwa me pipe kubreathe. Then oxygen. Oxygen boli kana itaria COVID-19. Antibiotica mitungi oxygen nyumba. So oxygen is very important. No muntu enda ita epinephrine. Kanoka muntu enda ita magnesium. Theophylline can also be given. Theophylline iliyochia kumeria na iliyochia ku muntu inyechio. Those are the drugs we use for treating asthma. And I've said treatment you can differ. You can change kuma severity, mild, moderate, up to severe asthma.
Daktari nanto Ramadan kona rasio tunidire ira muledire na rombo kona na kiana tena mbekwedu
ndo onyo kendo mbona na umbone mbidandi na clinic chia kwa Fridays and kuita wa life care medical services hospital mezzanine floor room 6 na umbidire kwa mbidandi kunkiona na ashi Friday chionde au mbidira nkira ni clinic yita wa pain management clinic na general patient. I'm a consultant in pain management.
Mbaya sana daktari nanto boko na kanya kuya Meru TV. Mulediri wa Meru TV nkada se mwanya nanto bako romera mubango ja Ugima Bwetu mankake mikeke ngibita watiri Mbaabu.